Hi, my name is Samantha. I have a son who's just over 2, and I am currently pregnant, 38 weeks or so, pregnant with our daughter. I had an emergency C-section with my son, and so I really didn't know what to prepare for that. I was like convinced I was going to have a vaginal birth. I don't know why. I was like, of course I'm not going to have a C-section. So I was not prepared for that. I didn't pack for that. I had no clue that that was what was going to happen. Now, with this pregnancy, I am scheduled for a C-section coming up here in a little over a week because of placenta previa that has turned into low-lying placenta. The placenta is still very close to my cervix. It's just over a centimeter away, so just for safety for me and the baby, we are going to be doing a C-section. And since this is my second C-section, I just thought I would give some tips about how I'm preparing for my C-section and ideas for how you could prepare for your C-section if this is going to be your first or second or however many C-section and you just want some ideas. First, what I did is I prepped a lot of food in advance. I made sure to freeze breakfast, lunches, dinners, and snacks and have that in a deep freezer in the basement, so that it's just easier for my fiance when he stays home and helps take care of me and the new baby and our toddler. The meals will be ready. We won't have to worry about it. Another thing that would be really good is to stock up your pantry, stock up on household goods, stock up on pet supplies, supplies for other children, just because you're not really going to feel up to going anywhere right after. I know I was in a lot of pain. It hurt to be in the car. That's another tip is when you are in the car, the seatbelt really hurt me. So I am going to get a small pillow this time and put the pillow on my incision and kind of press against it when we're in the car so that it's kind of a buffer between my incision and the seatbelt. And also when my fiance would hit any bumps last time, it was very painful. And so then if, there's a bump coming up or something, I can use the pillow to like lightly put some pressure against the incision. That helps a lot with that kind of pain, is to give a little bit of pressure. So if you're trying to sit up, get out of bed, anything like that, a little bit of pressure. Another thing that would be good to do and that I am doing or have already done is set up some postpartum care boxes or stations. I have a little drawer in the bathroom and a little box in the bedroom with the supplies that I need. That way I'm not having to run around or have my fiance try and find all of this stuff from around the house. It's just in one area. It's easily accessible. So some ideas for postpartum supplies would be the stuff that I'm using, stool softeners. Stool softeners is a big thing. You would think, just with a vaginal birth that might be an issue, but stool softeners. I always felt like I was going to rip open when I used the bathroom. It was very painful on my incision. It was just scary, so stool softeners are a big thing. Another thing for just new baby in general, hand sanitizer. To have hand sanitizer next to you because you are not always going to feel like getting up to wash your hands all the time before you touch the baby. So if you put some hand sanitizer on, that should be okay, just because it is super painful to get up and move around and go do anything. Another essential item for in the box would be pads. You do bleed after a C-section, not just a vaginal birth. You get the incision and then you get the bleeding just like a vaginal birth. So I did not expect to bleed as much with a C-section. I guess I thought, I was really naive. I was like, well, I didn't deliver vaginally. I won't have as much bleeding. Well, I did. I had a lot of bleeding for weeks and weeks and weeks. And so giant pads. But the best thing to put in your box that I loved is disposable, like adult underwear, like the Depends or the Always or whatever. Those are amazing. I have lots of those in my postpartum care boxes just because it is really gentle on the incision. It's easy, like with all the bleeding. For like the first week or so, like week or two, those would be perfect just because it helps control all the bleeding. You don't have to fumble around with a giant pad, and it's just so much more comfortable, I felt, on my incision. So that's the main things that I had in my postpartum care boxes. I know with a vaginal birth, I've seen people do like padsicles and like the tux pads and all of that kind of stuff, and it just really isn't necessary, I guess, with a C-section. An optional thing would be a belly binder. I have not fully decided if I'm going to use one just because my research has been mixed on if it's good or bad. My research that I've done has shown that it's good, it can help, you feel like you're pressed in, but it can also, if you overdo it, if you wear it too long, can make your muscles weak, I read, because it's not having to do any work. Like the binder is doing all of the work, and also if it's too tight, I read that it can increase your bleeding and cause like a prolapse. So I don't know if that's true, but I am just kind of still doing my research on if I'm going to do a belly binder or not. Another big tip would be have everything you need set up so that you do not have to go up and down stairs. So along with the postpartum care boxes, have like little baby changing stations, or little, like, have a pacifier if you use pacifiers and stuff like that in little stations where you're going to be probably on the couch or in the bedroom. Have little stations like that as well, just so you're not having to run all the way up or down or across the house to the nursery every time you need to change the baby. If you can, set up some help with cooking, cleaning, taking care of any other children for at least the first week or two after you're home. I know this isn't possible for everyone, but if you are able to, even just to have a friend stop by, or family, or anybody, fiance, husband, boyfriend, anybody, come and just help you for a little bit, just so that you are able to heal. Because remember, not only did you have a baby, but you had major surgery, so you need to make sure you take care of yourself so that your healing doesn't last a super long time. The faster you take care of yourself, the faster the healing will be over. So this could go for both a vaginal or a C-section birth. So I was very medicated during my C-section. I don't really remember a whole lot other than it being really traumatic, and that I did not want the baby next to me for the majority of the time. I wish that I would have better wrote down my wishes for my birth partner, for my fiance, so that in that case he would have known exactly what I would have wanted at that time. He did an awesome job of I'm so out of breath. He did an awesome job of figuring out what I probably would have liked, and he knew a few things that I had wanted, so it did happen. But it made me feel better this time. I actually have a list that I shared on my phone. I shared to his phone. That way he knows kind of what I would like done, especially if I am very medicated and out of it and just anxious. The list is already there. I feel less anxious about it now, and it's just done and taken care of. So some examples of what you could put on your list is, if you want whoever's with you to cut the cord, if you're medically able to, what kind of pictures you want taken in the OR, if pictures are able to be taken. If there's maybe a really nice nurse or something that could take pictures of you and whoever you're with and the baby, that would be really special. Also, another important thing is to make sure that you tell whoever is with you, or even just the nurses, make sure you tell them what visitors you would like beforehand, and be very firm about it. I I knew that I didn't want anyone that wasn't immediate family to visit me at the hospital, just personal preference. I knew I would not feel good, and this was even just when I was going to have a vaginal birth. I was like, I know I'm not going to feel good. You know, they can visit me later. I do not want anyone except for both of our immediate families there. And so that'll be the same with this time. It'll be our very immediate families. We really don't want friends or extended family coming to the hospital just because I don't feel good. I know with my son, I got baby blues. I get a little depressed. I think it's with the hormones. So it's just the least visitors are the best for me personally, so that I can heal both emotionally and physically. And so that would be an important thing for you to think of, and make sure that you relay that to whoever you have with you, or even just your nurses. Your nurses are great. Nurses are going to be some of your best friends while you're there. Make sure that you tell your nurses what you want, and they will help you out. One of my last tips would be to make sure you have your hospital bag ready even a little bit in advance. Like, you think just because you have a scheduled C-section doesn't necessarily mean that you won't have something happen where you need to go to the hospital beforehand. So I would say around like 35 weeks or so, even earlier if you're having issues. I know with my placenta previa, I had a small hospital bag ready to go earlier than that in case I were to have a bleed and have to go in. But just if you have a bag ready in advance, that way if anything happens, you know that it's ready. You don't have to scramble to find things. And it just might make you feel a little bit better and less anxious about the C-section if you know you have all of your stuff ready. I would say for sure for you and your baby, and then whoever you're gonna have with you, if you're gonna have anyone with you there, encourage them to get their bag ready as well. If you have any questions about what to put in a bag for a C-section, I will also be doing a video of what's in my hospital bag and what's in my baby's hospital bag. I will not be doing anything about what's in my fiance's hospital bag because he is a last minute packer, so he has some of his stuff in there. But last minute, I'm sure he'll throw some stuff in as well, and if he forgets anything, he'll probably just come home and grab it. We live almost an hour away from the hospital, but there's nurses there to help me, so he doesn't need to be there all the time. He can come home, shower, eat, grab what he wants, and then come back. So that's about all the tips that I could think of. I hope it helped a little bit. If you have any other questions, please leave them down below, and I will try my best to answer them. Otherwise, thank you so much for watching. If you like what you saw, please subscribe. Thank you. Bye.